I'm Emily Morin, and I'm a university student here at the University of Calgary, and I'm a participant in the knee injury study. It started when I started playing rugby around age 14 or 15, and I was running all the time, and I just started noticing knee pain, and it hadn't gone away after I played rugby. It just kept going on until now. I get the pain when I'm running, and I also get it when I'm just sitting there. So in classes, I have to extend my knee after a while, and it will click, and it hurts when I'm walking upstairs, walking downstairs, doing squats. Almost everything that I do, I have the pain. Not only was it annoying that I had it at such a young age, but then people that I talked to that were older, they're like, well, you need to get on it, you need to get physio, you need to get help. And I was getting help, and it wasn't going away. And I tried acupuncture, physio, chiropractor, and nothing was helping. And so I was trying, and it sucks to have all of your friends be able to do everything, and if they wanted to go run a race, they could, and I'm not able to do all that stuff. It's important for me to be able to be active and then also do everyday activities like walking up a staircase, or just if me and my friends went for a bike ride or anything like that. And then also to be able to be physically active and strive towards things like running a race or setting fitness goals. I need to be able to do the most basic things.
I'm Ferber. I'm an assistant professor in the faculties of kinesiology and nursing and the director of the running injury clinic at the University of Calgary. About 35% of Canadians are involved in running and running-related sports, and half of those people will get injured every year. Now, 80% of injuries are from the knee down, and 50% of injuries are to the knee itself. So on average, about 3 to 4 million Canadians will suffer from knee-related injuries due to running every year. 75% of people continue to have reoccurring symptoms over the next 5 to 15 years. And those people end up getting knee osteoarthritis just because of a nagging knee injury that they never really got fixed up for in the first place. So that's where our research is trying to prevent that reoccurrence down the road. We conducted a study. We were trying to understand the influence of muscle strengthening on changes in running biomechanics for runners with knee injuries. And surprisingly, very few studies, only one other study has been conducted to understand how do people run differently after they have successfully rehabbed from this very common running injury. So we wanted to investigate it. So we measured strength in terms of specific muscles within the hip and the thigh and the lower leg. And then we put people on a strengthening program for one specific muscle group, just one muscle group within the hip. And research has shown that this group of muscles, your hip abductors, the outside hip muscles, are really important in terms of stabilizing you. So we just focused on those muscles, and we also measured people's running biomechanics. We made them into a three-dimensional stick figure, and we measured the stride-to-stride mechanics of them running. A lot of runners are on the verge of an injury. Maybe they just self-regulate a little bit and they don't run quite as much, or they take a day off, for example. But now we have the ability to understand if somebody is on the verge of an injury, just how serious is it, because we can measure their stride-to-stride variability. But it's also very important in terms of rehabilitation. So if we get somebody stronger, but they still exhibit this increased variability of movement, that can tell the clinician that there still has to be more done in order to reduce their movement variability and bring it to within normal limits. We looked for a very specific group of people, and we only had 15 people in the study, but it was very difficult to get those 15 people because they were all running at the time. They had all failed conservative treatment, either through physiotherapy, chiropractic, athletic therapy, for example. They all had isolated unilateral knee pain, so they only had pain in one knee. And those people are difficult to get because a lot of times runners continue to run through the pain. They develop other injuries such as Achilles problems or hip problems. So to get those 15 people was actually quite difficult. And then what we did was we put them on the strengthening program for just 3 weeks. And what we found is that we actually increased strength by almost 35% within that short period of time. We cut their pain in half just by doing one simple exercise and dramatically reduced their movement variability from a stride-to-stride or a step-to-step basis. And then what we did was we actually then treated these people like we would any other patient here in the clinic. We gave them a comprehensive and individualized treatment plan, and 3 weeks later, 15 out of 15 were injury-free. I truly believe that anybody can run a marathon. It's a combination of many different factors. It's the training program that you're involved in. It's how strong you are in specific muscles. It's how you run and your variability of movement patterns. But to really increase healthy aging as a mandate, which is a mandate of the Canadian government, is huge for us. And the second goal is to really provide innovative health solutions in terms of improving injury assessment and improving the quality of the decision-making process. So evidence-based medicine, taking the opinion away in terms of, is that muscle too weak? Is that gait pattern off? We want to provide people with objective tools in order to do that. Then we can really transform Canadian health.